First, let's get into some health headlines. Joining us now, professor at Northwestern University Medical School and Morning News medical contributor, Dr. Lauren Streicher. Thanks for being here.
Hello.
We always talk the health headlines with you, so Larry's going to start it off.
Well, the CDC released a new report showing a rise in autism cases. What was their explanation?
It's pretty dramatic. They're saying that 1 out of 31 kids have autism. But there's a big difference between being diagnosed with autism versus that there is autism. What I mean is that we've gotten so much better at diagnosing it. The screening is better. We find kids in underserved populations that were not getting screened before are now getting screened. And keep in mind that autism is a spectrum from the very mild to the very severe. So when you say, how is it that it's increased so much in the last 20, 30 years? Those kids weren't getting picked up before.
Yeah.
So it wasn't so much that there's an increase. The CDC is very clear that it's that they are diagnosing it more, they are identifying it more, and this is so important because that means you can intervene earlier.
Yeah,
now, of course, the big question is, why?
Yeah.
Why? Are the numbers increasing? And what we do know, it is absolutely not vaccines. This is not controversial. There's not one credible scientist in the world who thinks it is vaccines because it has been so well studied. And of course, there are those such as RFK that say we need to study it more. It's already been studied, and my take on that is let's take those research dollars and study things that haven't been studied, like childhood cancer, just saying.
What are they thinking it might be?
People really don't know, and most of it really is an increase in diagnosis versus an increased number, but there's always the environmental concerns.
Mm-hmm.
We look at things like processed food, obesity, so many things in the environment that we really need to look at, but the one thing we do definitively know is that it's not vaccines because that's been well studied.
All right, how about some good news about a drug for dementia?
So this is really interesting. The GLP-1 drugs that are being used primarily to treat diabetes and obesity, they're miracle drugs. We're finding so many other things that they are useful for. We know that they decrease heart disease. We know that they decrease stroke. And now it appears that we can put dementia on the list by as much as 50%. Now, one of the things that's making it a little bit confusing in terms of the data is that we know that heart disease, obesity, and diabetes are risk factors for dementia. So are we seeing this dramatic decrease in dementia because we're decreasing these other things, or is this independent? It appears to be independent because it turns out that there are GLP-1 receptors in the brain, and that when they look at the baseline, what's expected in terms of helping with obesity and all, it's beyond that. And it's really been well studied. We're looking over 100,000 people. They were actually looking at dementia to see if this was a bad side effect. So they were tracking it very closely and found that there was a 50% decrease. Now, the real proof is going to be when we start to use GLP-1 inhibitors in people that don't have obesity and diabetes. When we're looking at things like addictive behaviors, drinking, smoking, compulsive shopping is my favorite, that shows that it decreases that, again, because of these receptors in the brain and in the pleasure centers. So interesting stuff.
All right, next topic, sperm counts are falling.
Yes, they are. Yes, they are. About 1 in 6 couples have problems with fertility in this country. The numbers seem to be going up. A lot of that is because, of course, women are older when they're trying to conceive. But it turns out that it's not just about the women, it's about the men as well. About 50% of the time when a couple's having a hard time getting pregnant, it is because of male factor, meaning either low sperm counts or sperm that's just not swimming in the right direction or is not normal. And the counts have decreased by almost 50%. What's this about? Well, we know obesity, smoking, and all of that is part of it, but it also right now appears to be diet related. One of the things that's interesting about sperm is, unlike eggs, you're born with your eggs, you've got them forever, you never make new eggs, but guys are constantly making new sperm. About every 3 months, there's a whole new lot of it. And so what they're looking at is by changing the diet, can you actually improve sperm counts? And the answer is yes, it appears that you can. It's not the only factor, but it is certainly a big factor. So the take home is if you're having trouble getting pregnant, do not wait to test the guy. That's day one. You don't just test the woman. And if there is a low sperm count, it appears that some changes in diet, particularly decreasing processed foods, can have a big impact on number and sperm motility.
All right, and what about, real quickly, BV, a common condition that could be actually a sexually transmitted infection?
Yeah, 1 out of 3 women have BV, which causes discharge, inflammation, irritation, and it is treatable with antibiotics, but the recurrence rate is sky high. We're talking 60% of the time. And while there's always been this notion that it's sexually associated, with women that have sex, but not sexually transmitted. And a new study was just done in which they took couples in which the woman had BV, and they treated not just the woman, but they also treated the male partner with both topical and oral antibiotics. And instead of the baseline recurrence rate of 60%, it was 30%, which is a dramatic improvement. So the message on this one is if someone has BV, that they should not only get treated, but their male partner needs to be treated as well.
All right,
Right.
Dr. Stryker, thanks again. Oh, I think we're out of time. That's the last one.
Yep.
For more information, you can check on Dr. Stryker's Substack, including your new podcast, Come Again. Thanks again for being here.
You're welcome.
Time now for On Time.